Good stuff. Hey, hold on, I gotta adjust this guy up a little bit. There we go. Okay. All right, everybody. So, can we see, hopefully, the whiteboard? All right, I hope so. Hold on, maybe not. Yeah, you're pretty close. All right. So, if it looks weird when I'm drawing down here, it's because I'm trying to do the tibia and the fibula. Okay, so these are your hips, and they're waving at me in there. Oh, is that Miss? I know who it is. All right, so tibia, fibula, and this is your femur. I can't multitask, so when people stare in the window at me and wave, it just throws off everything. So anyway, we're going to look at the hamstrings here, and you've got 3 hamstrings, but who can tell me how many heads the hamstrings group has? Good job, Miss Trotter. You raised your hand and answered the question at the same time. That's true. You're right, they have 4 heads because the biceps femoris is a 2-headed muscle, right? Biceps femoris? Cool. So, they all hook, by the way, to your hips kind of around here. Anybody know the lower hip bone that's in back? You got 3 hip bones. You got the ilium on top, you got the pubis up front. What do you got in back?
Ischium.
Ischium, thank you. The ischium's in your tuschium, right? And it looks like a big handle, by the way. Let me show you. It looks like a big handle. It looks like a big handle. It's got, if you look at these hips, this is the back of somebody's hips. These suckers right here with all these bumps on them, those are for your hamstrings. And they grab onto this. Very effectively grab onto this. Boom, like that. 3 of the 4 heads grab onto this. So, the biceps femoris is a 2-headed muscle, and the long head comes up here and goes down to the outside of the leg. There's a short head here that hooks onto the femur and goes to the outside of the leg too. So this is the biceps femoris. Yeah. So, the long head crosses over the hip and the knee, the short head only crosses over the knee of the biceps femoris. Does that make sense, what I just said? Okay, if it makes sense, then we should be able to talk about it and say some things about it. So, Miss Vincent, we're just talking about the biceps femoris and about the little bit of information that we've got so far right now. So what is the action, would you suppose, Miss Vincent, of the short head of the biceps femoris?
Just flexion of the knee.
Thank you. That was beautiful. And I love what she said. She said just flexion of the knee. It doesn't go anywhere else, everybody. It only goes from the femur. It's kind of like your vastuses. It only goes from the femur across the knee. All it can do is flex the knee. Miss Vincent, what's the action or actions of the long head of the biceps femoris?
Flexion of the knee and extension of the hip.
Thank you. She just covered the entire lecture, really, with that logic and everything. Thank you, ma'am. So let's look at the other 2. The other 2 is the semimembranosus and semitendinosus. And essentially, they hook on the medial sides. Yeah, cool. So those 2 both cross over the joint, and those 2 both do extensions of the hip and flexions of the knee. Yes, Miss McDowell?
So are those the ramus, is that what they are on the ischium?
Oh,
like the ramus is like the arm, is that like?
Yeah, yeah. I will try to draw something, but I'm terrible at this. But if you look at a side view of a hip, you've kind of got this crest, which is your ilium, right?
Mhm.
And then it kind of comes down here and it meets with this bone that's your pubis. And it's hard to explain, but your pubis has an upper arm and a lower arm. This would all the pubis right here. The ramus has an arm too. And this is the arm of the ramus, you're absolutely right. And so this is a way for them to describe different points on here. But it is the arm of the ramus. I'm sorry, it's the ramus of the ischium. You're absolutely right.
So the pubis also has ramus as well, right? Is that what you're saying?
Yes, I am saying that. Here's the tricky part, but here, let me help a little bit more. The pubis has an upper arm and a lower arm. The ramus only has an upper arm, but by the time you've done that, you've kind of created the hole that we call the obturator foramen. So this is a hip, right?
Yeah.
I know you know that, by the way. I'm not trying to talk to you like a child. I'm just trying to help you orient. This is an anterior hip, right? Let's go to the side here. This right here is the superior arm of the pubis or the superior ramus of the pubis. This is the inferior ramus of the pubis. This is the ramus of the ischium. There's only one ramus of the ischium because then it just is the ischium here. So they call this ramus of the ischium turns into the inferior ramus of the pubis that eventually turns into the superior ramus of the pubis. Because this is the pubic bone right here. That's the
So is it kind of ending like where that like indentation is?
Yeah, right here where my thumb is ending.
Mm-hmm.
So this is superior ramus of the pubis and this is inferior ramus of the pubis. And this, I want to kind of put my other hand back here. This is the ischium. The ischium and the pubis actually meet, and together they all make this hole here. So this superior ramus of the pubis, inferior ramus of the pubis, ramus of the ischium.
Okay,
Really?
I'm sorry that you had to put the skeleton on your shoulders.
No, I really want to explain it. I love the question. So this, if you wanted to, you could argue this is the inferior ramus of the pubis and this is the superior one, but people are like, it's just the ramus at that point. I mean, it's just the ischium at that point. But anyway, the ramus of the ischium turns into the inferior ramus of the pubis and then turns into the superior ramus of the pubis, and now you're back up into the acetabulum and the hip. Yeah. If that wasn't confusing enough. But anyway.
No, that actually helps. Thank you.
Good. So all of them, you're right, like to hook on to kind of the ramus of the ischium, or the ischium itself, really, they say the ischial tuberosity because of all these bumps back here. That's where they like to hook onto. And that's why those bumps are back there. And by the way, everybody, this is literally a handle, right? Back here. And when you pull on these handles, look what happens to, it's not a lot, but this is where you get your posterior tilt as opposed to an anterior tilt. When I pull on these down here, I get a posterior tilt. The hips want to rock back. Yeah, cool. All right, so I just want to kind of explain how this is kind of laid out. The beauty of this is you've got two heads on this side of the knee and two heads on that side of the knee for even pulling of your knee. So if somebody came to you with problems with flexion of their knee, or extension of their knee, really, you would look at the hamstrings. And you can't tell from this picture, but they actually get kind of glued together in this area. And so sometimes we'll even split the biceps femoris from the semimembranosus and semitendinosus to try to get them unstuck. Because when they're stuck, one side kind of affects the pulling of the other side. And your brain doesn't ever just flex your knee. It brilliantly tries to pull on both sides evenly to keep your knee tracking straight. Because knees, yep, this is a knee, and by the way, this is the patellar tendon and the patella and the patellar ligament, right? Knees do very well if you pull on them straight, right? But they've got this very narrow thing, and if you pull on them uneven, they start to do really bad things. And then you're in bad shape. So you want to pull on them very straight, and so you need to have heads on both sides that are theoretically pulling the same. And your brain figures out a lot of that, but if things get stuck back there, it's a problem. So sometimes some people will try to split up between their hamstrings to help kind of separate them so that your brain can choose to pull them separately. Yes, Miss Walker?
So if they're really glued together, I mean, what are you going to do to really separate them? Just try to kind of get in between those muscles?
Yeah.
Anything else?
I actually drop an elbow in there. And what I do is I go up from the back of your knee, because I don't want to hit the back of your knee, but right up about here I drop an elbow in, and you can actually feel a space between, it's quite noticeable between the biceps femoris and the semimembranosus, semitendinosus, and then I start to drive that elbow up the back of your leg. At which point you usually say, my, that is really pleasant.
Feels great. So if you start kind of down there where you can clearly feel where they're separate, it's easier to go up and separate them.
Yeah, thank you for saying that the way a teacher should say it. I really wish I would have said it that way. Yes, I go down to the distal part of the femur, and I go to where they are delineated, to where I can feel a separation between the biceps femoris and the semimembranosus and semitendinosus, because as they get down to the knee, they are separated. They have to separate. And I kind of find a spot right in here, and then I start driving up there to try to separate them up. And I don't mean they're truly glued. Well, I kind of do mean they're glued together. Their fascia gets stuck together. And so you cut them apart a little bit. And you're not really cutting them apart, but you're stretching them apart and peeling them apart there, and so that your brain can kind of work with the two of them separately. Yeah. Thank you for explaining that, though. Because you're right. I go to the part where they're delineated, and then I move to where I can't feel the delineation and try to split them apart.
So, Mr. Tascott, this is kind of in relation
Please.
to the whole gluing together.
Yeah.
So I noted, actually it was when I was massaging Miss Brody last week, I think.
Yeah.
That one side of her back, she was so tight, like where her scapula, the
Yeah.
medial border of the scapula, it was so tight that you couldn't really feel. It was really hard to feel the difference between the scapula and the muscles because the muscles were just so tight.
Right.
Is that more, the fascia that's so tight like that, or is it muscle plus fascia?
I'm pausing because you're asking the epitome of the change in massage in the last 20 years. So I'm going to try to answer your question. By the way, the quick answer to your question is it's the fascia. That's the quick answer. That's what I believe. But we're in really sticky waters because murky waters, so to speak, because there's very little separation between all those parts at that point. When I went to school, we were taught, and we will get into more of this later, but it's such a good question, I want to answer it right now before we come back. When I went to school, we were taught what you guys were taught in kindergarten. We were taught that the hip bone sits on the leg bone, and the leg bone sits on the ankle bone, and we really were. And so we really believed that, you took a person and you had a bone here that's their foot, and you've got the talus here, and the tibia sticks on top of that, and then the femur sticks on top of that. You stack a body up there like that. That's how you build a building. That's how you build a person. It's not that in 20 years we learned that you don't have tibias and fibulas and femurs and things like that. It's that we learned that that model is not exactly true. We learned that you actually work on a model of tensegrity, which again I'll show you a little bit just to get you thinking. If your bones were actually just stacked on top of each other and they just bore the weight of the bone underneath it completely, we don't think you'd actually make it a year. The amount of pounding that would occur if I just jumped like this, 230 pounds once you jump it up in the air like that and you land on it, just even once. If it's really just bone, even with padding between it, but if it's really just bone supporting bone directly, the forces don't work out in physics. And as we did body work, as body work got more and more advanced and people started figuring out that model doesn't work. And what they realized is that we actually work in a suspended model. So this is a tensegrity model. It does not look like the human body, but it illustrates this very simple point. These sticks could be your bones, and these black rubber bands could easily be your ligaments, tendons, and associated fascia. And what's really cool about this model is that the bones never touch each other, and we don't really want them to in your body either, and we don't believe they really do in your body. And what happens with a tensegrity model is tension is actually shared throughout the whole model because the bones are actually floating, and it's the connective tissue that works off these levers to keep them from ever touching one another. So believe it or not, when I push these two things together, you're actually going to notice that other bone, if you look at these two bones on top and bottom here, they will get closer together as I push these together. If I pull these out, the other bones get further apart. And so the whole model actually works on the fact that it shares stresses with everything. And that model seems to explain why the human body can do certain things that can do, why you can jump off your neighbor's roof, or you can go run 10 miles and you don't just completely grind down your bones. It's because we don't believe your bones are really hitting. They're actually kind of suspended in this model that where these two come closer together like that we'll actually see the other ones come closer together as we do that. Or if we pull this out, the other bones get farther apart. And it's called a tensegrity model. I say all that to try to, a long-winded way to try to answer your question, Ms. Walker, which is, as the muscles give way, as they're tight over time, we think that the fascial connections start to tighten up. And if you're experiencing somebody's back where it kind of feels like a board, we don't think that's just tight muscles anymore. We actually think the fascia is kind of woven in there and gotten hardened and tight. And it does that, we think, because the muscles get so tired of trying to hold the stresses of the body up that they start to harden in that area. And so I would suspect it is essentially more a fascial problem than a muscular problem. One of the ways I would prove that is if it was really just a muscular problem, you'd probably be able to solve it with one massage. True muscles are highly vascular. They get a lot of blood in them. And if you have somebody with just a knot or just true muscular tension, it's very easy to stretch and massage out. Muscles are highly responsive. But when you get those people where their back, which is, by the way, half this class, including me, so don't feel bad, anybody, but where their shoulders are just like a board back there, and you're like banging on them, that is fascia there because somebody's been working so hard, sounds like Miss Carodi, right? Hard-working lady, working so hard that all that tension up there, the fascia finally starts to try to help you out. It kind of locks down the area and the fascia actually thickens there and becomes less elastic, but it holds your shoulders there. And it comes from working really long hours and all this kind of stuff where you can't get a break. So I think that's fascial stuff, and fascial stuff just takes longer to fix, that's all. It has less blood going to it. It's a long-term adaptation, and so it will take longer to change. Whereas muscle can be a very short-term adaptation. Your muscles get sore after the gym, right? That actually heals up in a couple days. So fascial adaptations are more. The reason it's a really hard question to answer is that we get to a bigger question of maybe muscles aren't the most important thing in the body, but it's really the fascia that's around the whole body. And the muscles are, fasciologists, people like me, actually look at everything as fascia, and some of your fascia has contractile tissue in it, and that's your muscles. But your muscles are all fascia too. They've just got some tissue inside them that allows them to squeeze shut. But they're still completely surrounded by fascia. So we actually look at you as a fascial system with some pockets that have contractile tissue. Anyway, I think it's your fascia. Sorry for that really long-winded thing. It was just a very complex question, and we will explore it more.
No, I appreciate it. And
Yeah.
I have one more.
Yeah, please.
Kind of up by the neck, when people are at like computers a lot and their neck is forward, they kind of get that hump right around like C7. Is that, we're thinking that kind of like gets that buildup of fascia, which is why it takes several sessions to kind of really start breaking that down.
Yeah, I don't understand the process fully, but yes, 100%. So we call it a dowager's hump. I've never called it that to my client, but that's what it's called. And we see it on lots of people. Probably many of us have some small version of it, right? But some people it's very pronounced. And what happens is, you're absolutely right. This head is heavy. And I don't care what shape you're in. After 8 hours, 5 days a week, this is a really hard position to hold. And I start like having a problem with that. Well, my body is very intelligent. And it will adapt to that. It doesn't see that as good or bad. It just adapts to that. And since the muscles can only hold so long, what happens is the fascia thickens up back there. Do you remember the ligamentum nuchae?
Yes.
Okay, so it's a ligament from the back of my head, from my occipital, external occipital protuberance down to C7, and part of its job is to hold up my neck without me using muscle, really. And so that type of stuff starts to thicken, and so everything around C7 starts to thicken, right? Because C7 is kind of where the shoulders hook to hang off the back, and the head hooks to, and so you're absolutely right. You start to see that type of thickening, and that's where it takes multiple sessions. And I personally think they'll get relief from one session, but multiple sessions, and by multiple, I mean maybe months worth of work. But I also think, I'm not sure they're going to get better unless they start getting up from their desk too every hour and, you know, start working with you, because it's just too much. It's just too much for your one massage to solve. But that is long-term. So muscles tend to help us deal with short-term stuff, right? I've got to lift these heavy boxes today, right? So just use Miss McDowell as an example, because she went to the gym, right? And I'm not trying to make fun of you, honestly, but her body wasn't used to her going to the gym. Her body's used to her doing other stuff, right? So she got a lot of muscle soreness out of that, but her body was like, okay, muscles are tired, and we adapted to a new situation instantly. Whether you like the adaptation or not, they did a great job. They did. When your body starts to have long-term stuff, it makes these fascial changes. And so we can actually look at people's fascia and tell what their long-term stuff is, kind of like smile lines, right? That you get those from lots of smiling over long-term. Fascia is like that. So fascia is your long-term adaptation to things. Muscles are your short-term, like let's just lift this kind of thing.
And that specific thing, I know we talked about like kind of how to work it, but it's just, I mean, really it's just normal shop where we're just kind of trying to strip like away from the spine and, right?
Yeah, the only thing is, this is not, by the way, the type of massage that sells really well, although it's effective, so maybe it does. But yeah, you would do all that kind of stuff. If you could, you'd do it dry. Because when you're getting the dry work and you're going painfully slow, and I mean painfully slow, you're catching the fascia and you're probably stretching that out. Whereas I tend to go faster when I'm just trying to warm up the muscle or the tissue really quick, right? But you're actually trying to stretch stuff on a micro level, and you want to set your elbow in there at their C7 and just let it slowly come out, and you actually let their fascia set the pace. So I start pushing down and out laterally, and I literally don't move until their fascia lets me move. And it's really slow. It could take 5 minutes to do one stroke. It's this long. Like you're just going really slow, but super darn effective, because fascia really responds well to slow, long held things. Think about it when you guys stretch. People are saying you're stretching your muscles. You're not. You're stretching your fascia. Your muscles are easy. And what works really effective for stretching? Long, sustained, held stretches. Same thing's true with fascial work. So a lot of therapists will tell you, not all of them, but a lot of therapists that are really into therapy will tell you that they're like, I only do dry work. Like because that's what works. So I'm not suggesting only do dry work, because clients like oil, and I like to make my clients happy. But when you're there to get work done and really stretch something out, you don't want lubrication. You want to grab the skin and just slowly, slowly, slowly work it. Yeah. Did that answer your question?
Yes, it did. Thank you.
Thank you.
Perfect.
Thank you. Super insightful. Okay, I'm exhausted. That's all the knowledge I have. So, no, I'm kidding. Let's take, though, a 15-minute break before we talk about before we go over the hamstring slides, if that's okay with everybody. Alignment, because they have a lot to do with pelvic tilt. And tight hamstrings can put extra stress in the backs and things like that. So let me present this here to you really quick so we can look at some stuff out of your book. Boom. All right. You can all see the leg here. So this is kind of important. it's where the hamstrings are located, and I know you all know the hamstrings are located in the posterior thigh or the posterior femoral compartment. That's 100% true. But I want you to look at this picture and I want you to think about it the next time you're massaging. This is somebody prone, face down probably, right? We are seeing them from the back side. The vastus lateralis makes up the lateral side of the thigh, all the way to the back. And things like your gracilis and your adductor magnus and all that other stuff, they make up the middle part of the thigh. So your hamstrings live in what some places, maybe your book even might call it the shoe box. They really are boxed in between these two muscles. They really are. And so you can actually go up to most people and kind of grab all four of their hamstrings like that. You can kind of grab them right there. I don't mean you can lift them up or whatever, but you can actually kind of wiggle your fingers in there and kind of grab them. Because they're boxed in between the vastus lateralis and the adductors. So it's not a big deal. I just want you kind of aware of where they really live. And usually when I'm rubbing the back of the leg, and this is completely fine, but I'm being sloppy. I'm hitting all the hamstrings, but I'm hitting the vastus lateralis and the back side of all the adductors, especially the adductor magnus because it's way in back. So we're hitting more than just the hamstrings because the hamstrings actually only live in this little space. They're only about as wide as my hand. They live in the little shoebox between the vastus lateralis and the adductors. Cool? Just things to think about when you're working on them. And I hope you do that. I hope you guys kind of think about stuff. Or I know this little, I know this is kind of TMI, but it's good TMI. Like when my girlfriend and I are laying in bed, I'm often like playing with her muscles, and she's like, "What are you doing?" I'm like, "Oh, I'm thinking about tomorrow's lecture, and I'm just kind of checking where the stuff goes because it's great. Because I'm still learning, and I'm like, oh, that's right, I forgot. You can kind of access that thing, and she likes it because I'm rubbing her. She doesn't care, but I'm always like, I'm really just exploring. So think about that. Play with somebody's leg and just kind of see if you can't find the hamstrings. Lab partner, boyfriend, stranger, it doesn't matter. Meet them at a party. Say, can we check this little part? It's their hamstrings. Okay. Point well taken. Oh, and by the way, Miss Walker, you can kind of see the area where I start my massage if I'm trying to split the hamstrings. This area right here. Right here. I will try to drive up right between these guys. Yeah. So hopefully that makes sense. Yes, Miss McDowell.
I don't know if you're gonna be able to answer this.
Probably not. But one day you will ask a question I can answer, though, and I'm looking forward to that day.
No. I'm just gonna ask my question because
Please.
I'm getting caught up. If somebody has like a bump, like in like the back side of their knee, not a bump, but like an indentation, could that be like, I don't know, it's hard to explain. My older sister she's big, she's obese.
Okay.
And like the back of her leg, like her thigh, like, you know, you can see like the muscles going like down to the knee, but then like on the back of it, there's just like a indentation. Is that kind of like what you're talking about, like the back of the knee, like the plantar teres area?
Well, it depends. Are you talking about this area where my little cursor is right here?
Yeah, it's kind of in that area, but it's only on like one side where it's more pronounced.
Okay. All right. Here I'm guessing, by the way, but here's what I'm guessing based upon. Like I'm guessing because I haven't seen your sister's leg, so that's really hard, right? But I'm guessing it has something to do with there's no muscle kind of in this area that I was showing you right here, and so there could be an indentation there, and the fact that it's more pronounced on one leg than the other could literally be just the way the adipose tissue and the fascia there have formed. So, you know, all that stuff's kind of sticky, and it's possible she just it's stuck in a certain way there. And when you are heavy, that's a lot of adipose tissue that the fascia has to all keep together, and it gets dimply, and, you know, this is why we don't like cellulite and things like that. Cellulite has nothing to do with your body weight, by the way. You can be skinny and have cellulite. But cellulite is actually, the way water and the fascia is formed around the fat that gives it that cottage cheese look that we all think is so attractive. But it has, but we can actually, you can actually, by the way, massage cellulite away, just so everybody knows. It'll come back, but you can massage it away. So
it's not like a cellulite indentation. It's like if I had my finger here and I like stabbed my finger and there's like a little hole.
yeah, I gotcha. And so what I'm guessing is there's like some little lack of adipose tissue in that area, some little anomaly, or it's stuck to the back of the knee in some weird way. But I don't know why I'm suggesting that it's different on one side than the other because people aren't even in the way they carry their fat.
Okay.
Yeah. And I'm guessing it's actually has more to do with the way the fat is formed on, the adipose tissue is formed on that side of the body. And it's just a little anomaly in that area. And I would actually rub it on both sides and see if they don't start to even out a little bit. Out of curiosity.
Yeah, I always poke it. She's like, ow, that hurts.
Well, maybe you shouldn't. Also,
yeah, probably not.
when you're here in person, if you could kind of show me on anybody's leg kind of where you think this is, I might be able to make a better guesstimation.
Okay.
Yeah. Sorry.
Sorry for sidetracking.
No. I got you. We were talking about dents, and we're talking about the back legs. It's pretty close. In this class, it's super close. Okay. So this is a posterior view. We're looking at the back side again of somebody's body, right? We have removed the gluteus maximus because you can't really see the origin of these muscles up in the hip unless you remove the gluteus maximus. But this is why I like to rub, assuming somebody feels comfortable with it, we can do it properly. I like to rub somebody's leg all the way up until I hit the bottom of their bottom, right? I'm not trying to hit the bottom of their bottom. What I'm trying to hit is this thing. I'm trying to rub up until I hit that. Because I would like to get to the origin, and you can, right? So that's the origin of the 3 of the 4 heads, right? We know one head that you can't see really. The short head is actually hooked onto the femur. But you can see these other heads, and they all have an origin on the ischial tuberosity, or the tuberosity of the ischium, and then they go down to various sides of the leg, and we're going to talk about that here in a second. Okay, so let's talk about the biceps femoris. The important thing to remember about biceps femoris is it's on the lateral side of the leg. I realize it moves medial here eventually, but it's the thing that hooks on the outside of the leg. And since your tibia, also your big bone tibia, has a tiny bone fibula next to it, and the fibula is on the lateral side of the leg too, right? The long head likes to come down and insert into the fibula. Yeah. Actually, both heads insert really into the head of the fibula, long or short, right? They like to go down. So, and I remember that because I know the fibula is on the outside, and I know the biceps femoris on the outside. So of course it's going to grab onto something across the knee that's on the outside, and that's the fibula, which is the tiny bone next to the thick bone underneath your knee. So anyway, biceps femoris, long head starts on the ischial tuberosity, short head really on the back of the leg, but it says the lateral lip of the linea aspera. And they both insert into the head of the fibula. If we look at the semitendinosus, it has ischial tuberosity again, right? And you'll look, this ischial tuberosity has got stuff hooked all over it. It's all hamstrings. And it inserts into the pes anserinus, which is on the proximal medial shaft of the tibia. Does anybody know what pes anserinus means? Okay, I wouldn't expect you to. I just didn't know if I had mentioned before. Pes anserinus means goosefoot. Pes anserinus means goosefoot, and it is a place on your medial tibia, proximal medial tibia, which means your tibia on the medial side between your legs, close to the top, not distal, proximal. And if you guys rub on the inside of your tibia, kind of it feels just like it's bone there. You should find a real sensitive spot. You won't feel much of anything else. You won't be able to feel the pes anserinus basically, but you can feel a real sensitive spot on the medial side of your tibia underneath your knee. That's the pes anserinus, and it's called that because 3 muscles come down and they look like a goose's foot when they come together. And 3 muscles come down on the inside of your pes anserinus, and this is important later to structural anatomy. One is the semitendinosus. The other one, by the way, is the gracilis, which comes from your adductors, and the other one is your sartorius, which comes from its own little, it's its own group, right? But those 3 muscles come together and they insert into the proximal medial tibia at a place called the pes anserinus. I want you to recognize that they go into the medial tibia because the tibia is on that side, and that would make sense. All right, and we're going to find that essentially the semimembranosus does too. The difference of the semimembranosus is it attaches to the posterior aspect of the tibia, which works too. So the semimembranosus kind of hooks on the back of the tibia. The semitendinosus kind of hooks onto the side of it. But they both hook on the medial side. They really do. It too has an origin on the ischial tuberosity. All these muscles have an origin on the ischial tuberosity, essentially. Yeah. Cool. That's really it. It really, really is it. I would love to show you something on my model of a leg, but that's gone now too. But not stolen. I know where it is. It's the same place the skeleton was that I forgot all about. But I learned my lesson. Anyway, that is the 3 hamstring muscles. I want you to remember that essentially, and I keep saying essentially because of the darn short head of the biceps femoris, they all have an origin on the ischial tuberosity. That bone that you are sitting on right now, that you probably feel if you're not sitting on a comfy chair. You definitely feel when you're in class. And they all go down to one side of the knee or the other. The biceps femoris goes on the lateral side, semitendinosus, semimembranosus go on the medial side, all that good stuff. And the semitendinosus goes into the pes anserinus, which we will learn later provides structural support for your knee, for one thing, because knees have issues. That's for sure. All right, questions, comments? Here's somebody grabbing them like I was talking about. So apparently your book thinks it can be done too. Very cool. Yeah, you can try to find them and isolate them. That's always fun. Okay.